afternoon, Minnesotans. Good afternoon, community members. This is your community leader, Samba file. This show is all about for the community members, Samba around town. I found it very interesting to educate the community, to let people know about the wonderful things that are happening in community and oftentimes we don't know about. Today we have wonderful expert Dave Garibaldi joining us along with Anne to talk about healthcare for all, Minnesota healthcare for all. Dave, thank you so much for joining us.
Well, thanks for having us, Samba. And I might add that Anne is the vice chair of Healthcare for All Minnesota.
As you see, we have a pretty good company tonight. As Anne, thank you so much for joining us.
Glad to be here.
Why do we need Minnesota Health Plan?
Well, we have a system of paying for health care in this country that costs too much, does too little, and leaves too many people out. I spent 45 years in nursing, and once I got done with the paid workforce, I started getting very involved and much more informed about how many people are left out of our system and how many people are put at financial risk because of the way we pay for health care.
Okay, well, tell us more about the healthcare for all, Dave. What is, for somebody like me who don't know much?
Healthcare for All Minnesota, the organization, it's dedicated to promoting affordable, high-quality health care for every Minnesotan. So we are advocating through educational events and tabling and community organizing to get people to know that there's a better way of doing healthcare financing in the state of Minnesota. What we have now is a piecemeal, very fragmented way of doing healthcare financing through our private health insurance companies, and we need, and public. It's kind of a patchwork, and so we need to approach this from an efficient, simple way. And with that, we are promoting the Minnesota Health Plan here in the state of Minnesota.
Well, again, Samba around town. Today we are talking about healthcare for all. And if I may ask, what are the goals for healthcare for all?
Our first goal is to make sure that everybody and anybody can go to a doctor when they need to, without financial barriers, without a concern about out-of-pocket costs or am I covered or do I know where to go. We favor a system that in which we would set up a health fund that everybody can contribute a little bit to, and that we use money that's currently going into our healthcare system right now, but funnel it into something that is more efficient and, as Dave said, simpler to use, and would offer everyone, first of all, universal coverage. That means every single resident of Minnesota, regardless of income or any citizenship or eligibility status. Eventually, we'd like a national health plan, but we realize that that's very difficult to accomplish right now in our current political environment. So we're working hard to see if we can get something started here in Minnesota to show the way, so to speak. So universal coverage is our first goal. And eventually, a system that is more comprehensive and simpler to use, we would put a government agency in place to administer on our behalf. So a publicly administered, publicly funded, but delivered. You would still get your health care through clinics and hospitals that you're familiar with. So those hospitals and clinics remain either privately owned or publicly owned the way they are today.
And I know this might be also coming from our viewers. Do you believe that we can offer to cover everyone in the state of Minnesota?
Yes, I strongly believe that not only we can, we should, because it's a justice issue and a fairness issue and a public health issue, but we can. We currently spend nationally $4.3 trillion on health care, almost 20% of our economic activity in this country. And 1/3 of that money is going to the administrative burden of the multi-payer system that Dave talked about. All of these commercial insurance companies and then all of the public programs that have to fill the gaps in our patchwork coverage system. So if we could cut that administrative cost probably in half, we would have more than enough money to cover everybody.
Well, I know for you viewers, you might be wondering, how is this going to help your families? Dave, how will the Minnesota Healthcare Plan help families, especially those of us who are in there working hard, earning our own income, or oftentimes receiving health care from our employer, and not knowing that it could be better to have more health care services? How is this all going to help our families?
Well, the current system, private health insurance companies are there to make a profit. Even the nonprofits are there to make a profit. Their business model is the same. Every time you submit a claim or your provider submits a claim, that's considered a loss for that company. So they're there to avoid loss. If they can do it by denying your care, they will. If they can do it by delaying your care, they will. Employers offer insurance, and most people are covered under an employer plan. And the thing is, they pass that cost onto their employees even if they do not, even if they cover the whole thing. You have to remember that wage stagnation has been going on for 40 plus years now. And a lot of that wage stagnation comes down to increased insurance costs for employers. They can either pay you more wages or they can cover the cost of your insurance. Most employees want to see that insurance there. They don't want to have to go it on their own, that's for sure, because that's even worse. But when it comes right down to it, that's spiraling out of control to where premiums are higher than ever. Less money is going toward wages because of that and other benefits. And the Minnesota Health Plan would actually stabilize that and decrease the amount that middle income people and low income people especially are paying. It's estimated that a single payer system, 90% of people will pay less and with a single payer system, if not 95%. Some people who are more affluent will pay a little bit more. But it will be based, for families, it'll be based on the income and with a payroll tax, and therefore they won't be facing these astronomical costs every year. And for employers, it's also a matter of they won't have to be searching for health care every fall to find for their employees. This will just be said and done. The care will be there, and with a more comprehensive benefit set. And most equally importantly, lower cost sharing. We talk about deductibles and co-pays. Those have been going up the last few years quite a bit. And that means that families are having to dig into their after-tax money to be paying for all that. And they won't have that anymore. They won't be the cliff for young 25-year-old, 26-year-olds who go off the cliff and have to find their own coverage because all of a sudden they're off their parents' plan.
Well, and that's a very valid point. And how will the health care plan help seniors? Because as most of you know, we have an aging population that we really need to look up to. How would this plan going to help our seniors?
So seniors in the U.S. since 1965 have had access to Medicare. You're familiar with our health insurance plan for seniors and the disabled. Unfortunately, that probably doesn't include undocumented persons. So one improvement would be that the Minnesota Health Plan would cover all residents of Minnesota.
That's good.
We do not distinguish between persons who are citizens and non-citizens. So that's a benefit. Right now, the Medicare is good coverage as long as we keep it, we retain Medicare as a publicly funded program. It is becoming increasingly privatized and monetized, and we strongly oppose that and are working with others around the country to try to roll that back and turn Medicare back into a publicly funded, publicly administered program as it was originally designed. So that's one fight we've got on our hands right now. But the Minnesota Health Plan in particular would cover what people are often expected to buy, some private insurance for the outpatient care that is not covered by Medicare. It does a good job of covering hospitalization, but it doesn't do as good a job covering outpatient care, specifically prescription medications, vision, hearing, therapy, and those kinds of dental care. Dental care isn't covered by any health plan, really, for reasons that are kind of historically true. Dental care has been left out of a lot of health plans. So the Minnesota Health Plan would actually be sort of a wraparound plan, would cover what Medicare currently does not cover. So that's a very positive thing for seniors and for the disabled.
What would be the benefit for those who are already working for the healthcare industry? Would they be losing their jobs? Would they see a job reduction, or how is this going to benefit them who are currently in the insurance companies?
Well, the commercial health insurance industry would essentially not be needed anymore. However, there will still be jobs. We know for approximately how many people would need to be retrained, redeployed, re-employed. It's under 45,000 people in Minnesota. So it sounds like a lot, but it's actually a fairly low number considering how many people change jobs every month in Minnesota. So the Minnesota Health Plan, any implementation plan would include retraining benefits and time needed to find something different. Small business owners are telling us that they are ready to expand if their cost of insurance went down or at least stabilized. So there will be more jobs due to entrepreneurial activity, small business growth, and there will also be jobs on the administrative side of healthcare. We will need more healthcare givers, healthcare providers. So there's going to be actually more jobs in the healthcare field if that's not of interest to insurance company employees. There will also be some administrative jobs because we will still need things like hospitals and clinics will still need personnel, they'll still need inventory, they'll still need accounting help, so it'll just be a lot less expensive.
I know our viewers would be more interested also to know that there is a safety net for also union workers. How would this also be helping the union workers?
I don't know if any insurance industry are covered by labor union contracts, but labor unions have invested a lot of effort, bargaining power, into bargaining for health insurance benefits for their members. And we're working hard with the labor unions to understand that they are expending a lot of bargaining power just trying to hang on to what they've got, which is becoming more and more expensive. And they're starting to understand that if they didn't have to worry about bargaining for health insurance, they could put more effort into bargaining for terms and conditions of employment, wages, and pensions.
I know
So I think
when
that's going to be a plus.
when we are always looking at unions, A, we have the safety net, but B, we're looking at finances. How is the single payer you just referenced earlier is going to be financed?
The single payer financing for healthcare is going to cost less overall. It will, first of all, you remember that 34 cents out of every dollar is going to the administrative burden of the multi-payer system. We think that we can cut that approximately in half. So there'll be some administrative costs, but it'll be a lot less. The other thing that will be possible if you put a big customer, like a state government or a federal government, in charge of prices, we can start driving down the prices of drugs, devices, diagnostics, fees, and even cost of hospitalization. So there will be some downward pressure on prices, and I think there'll be a lot of money available to put into actual health care and actual public health.
Is there any more services that the healthcare for all would cover other than the current status quo? Why do we need to have the healthcare for all right now?
I will tell you that in a second, but I wanted to add on to what Ann just said, that we're spending twice what any other developed country in the world is spending on health care, and our outcomes are dismal compared to the other wealthy countries in particular. The Commonwealth Fund does a analysis every year of the top 12 wealthy countries on Earth, and we are dead last by quite a ways on health outcomes. Our life expectancy is dropping compared to other wealthy countries, especially since COVID, because we handled it so poorly. And it's just, those things are going on and on. So I want to come back to, could you
Yep, my
rephrase?
question is if you were to look at services that would be covered under this healthcare for all, what would that be? Knowing that now, as Ann mentioned, even the undocumented might see a mean to have a little bit of help because they suffer a lot in our country. How would that go in to help them a little bit if we were to have this health care for all?
Well, the Minnesota Health Plan and Medicare for All on a national level would cover all necessary care that we see now, and without any delays and denials, you wouldn't have that kind of thing that private insurance is doing because you don't have the profit motive anymore. We're just, the Minnesota Health Plan is there to provide people with care. So that said, we would have dental, vision, hearing, long-term care. We would have prescription drug coverage at 100%, no copays, no deductibles. That's huge for a lot of people who have serious health problems with that need some of the cutting-edge drugs. For that to be covered, there's people that pay $10,000, $15,000, $30,000 a month for coverage for the health care. As Ann said, we will be able to put a lid on this price gouging that the pharmaceutical companies have been doing so well. We pay as much as 10 times what some other countries charge for the same exact medications. And Medicare has been absolutely prohibited by Congress to being able to negotiate drug prices like the rest of the developed countries on Earth. It's another thing your viewers might not know.
As you have heard, and this is something that's very touchy to me because I work with a lot of undocumented immigrants. And I do know, and kudos to our federal government, they're trying very hard to assist all these immigrants who are undocumented or sometimes illegal, to give them that basic necessity. Because right now, as we speak, throughout the border, at the southern border, we have a huge afflux of immigrants coming in. Some who are dragging in issues prior to getting to the border. And our federal government is trying to do whatever they can to at least provide that basic care. Why not a public opinion instead of the health care for all?
Are you referring to what's commonly called a public option?
Correct.
Our concern about that phrase is that there is no one plan to describe a public option. There are several. At the federal level, there are at least seven different bills, I think, right now that have been introduced that they're calling a public option. And what they really mean is it's a way of getting a few more people covered with some public subsidies using private insurance plans. And that really doesn't fix the underlying problem of the cost of our multi-payer system. That 34 cents of every dollar that's going to the administrative waste because we have so many different programs to be administered and managed. So, and frequently, the bills that are written are designed to try to offer affordable insurance, but that means the coverage is a little bit too thin, meaning the out-of-pocket cost for the person covered could be as high as 30%, and that's a lot of money if they require hospitalization. Plus, they're often required to cover some deductibles and copays. We'd like a system that eliminates all of that.
I know, as Dave talked about, and especially getting out of the COVID with a lot of things that are not yet met, would there be any waiting line for services to be rendered if we were to move forward with this?
One advantage of the Minnesota Health Plan and Medicare for All over a public option is that there's provisions within this legislation to build up, put money toward increasing the amount of providers we have where we need them. So that's a very important aspect that these other so-called options are really not covering or exploring. It's almost as if they don't want everybody to be covered so much as they want to have something that looks like they got something done. And so we would like to see the single payer plan because we would start ramping up that investment in our doctors and nurses and getting more healthcare providers, getting those staffs built up to handle the extra load.
Something to understand about a better, more comprehensive system is that yes, there would be increased demand early on as you implement universal coverage, but we think that would taper off once people's immediate needs are met. And we have to remember, even if people wait right now in our system to see a specialist, they often even wait to see a primary care doctor, and we have people who wait forever because they're not covered. So they're not even in the line. If people want to talk about, would there be waiting
list, like a waiting time?
They can't even get in the line because they don't have coverage to begin with. So we need to eliminate that first.
I am very grateful we are in a very great city, in a very great state, the state of Minnesota. We have a need, an urgent need to serve everybody, every single resident in the state of Minnesota. My question, is there a health plan socialized medicine in Minnesota? Do we have one?
Yes, the VA.
We have the VA health system. And lest anybody attempt to throw any shade on the VA health system. I'm retired military. I know lots of people who use the VA health system, and they're very happy with it. In fact, the VA health system ranks better than our private healthcare system by a lot of measures. It's been studied by the RAND Corporation, for example. And patient care delivery, patient outcomes, and patient satisfaction are higher for the VA health system than, and that is a fully publicly funded and publicly administered, and employees are actual public employees of the VA health system.
Well, that's very good to hear. Very good to hear.
And then we do have a U.S. Public Health Services who care for Native Americans in Minnesota and around the country, but it's less well funded and less well staffed, so a lot of Native Americans are on Medicaid as well.